Hello everyone, and welcome to my second project for ISC 455. My name is Jeff Greep, and this is for University of South Alabama, my appointment referral linking case. Okay, the business case for this is going to show an appointment referral linking system can be used, and to some extent how it can be used and applied in operating practice. Here are other modifications that I'll talk about as we go through this that can be implemented along the way that could better suit the needs for a doctor's office. Kind of all vary on, the type of software they're using and how this can be, put into place for that. The executive summary for this is directly from my business case. I'll read that to you real quick. And basically, it says this: the appointment referral linking allows doctors' offices to match appointments to referrals for care. Most patients are seen in a specialty care setting require a referral for care and treatment. When a patient makes an appointment for specialty care, the electronic scheduling system should indicate whether there is a valid referral on file. By ensuring a valid referral on file, it prevents a lost appointment time due to early verification. If a valid referral is not available, the appointing system will either delay scheduling or allow an appointment or allow an amount of time to obtain the appropriate referral prior to the appointment. The goal is to see that all patients are seen in a timely manner without loss of patient or physician time. Okay, let's take a quick look through my ERD. You can see I used basically 5 tables here. There could have been a lot more, obviously, but just for the sake of this project, I kept it down to these 5. The ones that could be expanded is, you could have a separate table for insurance companies and things like that, or a lot of different areas you could capture, more data on further tables. But basically, I made use of these 5, and that's the patient table, appointment table, physician table, and this is for the specialty physician you're seeing. A primary care manager table, that's who basically is issuing the referral, and then this is the referral down here at the bottom. And basically the patient is tied to the referral, the appointment, and the primary care manager. And then the referral is also linked to the physician who they're going to be seeing and the appointment. So that's kind of how it's set up with that. Again, we'll go to we'll do a quick walkthrough of my database and access. So stand by while we switch over to that. A couple of points of interest here that I want to show is I have, like I said, my 5 tables here. Let's start with the patient table. What I use, the patient ID, is just an auto-generated number on this. I didn't use their social security number for a particular purpose, and that's for security issues. A lot of doctors' offices are getting away from actually having to ask the patient for a social security number in order to look them up in the system. They're using their date of birth, or they're using some other identifying factor that they can pull them up with. So they'll pull them up by, say, the date of birth and their name, because it's more chances that there's going to be somebody else with the same date of birth that you than there would be a social security number or something else, if those are supposed to be unique. So anyway, that's kind of how I did that. Another thing I want to show you on this particular table is, I use last name, first name, date of birth, patient's phone number, insurance, and patient's or primary care manager ID. And you can see here the ID is a number, and when you click on it, though, if you look at it, there's actually a couple different numbers here, and those are based on my primary care manager table that I have. So we'll go back to them in a minute. But anyway, this is called a lookup table, and it uses a link to this other table, and that way you can see what the data says. So instead of saying, well, I think it's number 1, but I'm not sure, it gives you an idea of what it actually is. So it's better to get some good data in the system. And then we'll pull up the primary care manager table, and you can see there's that doctor, Jack Stone, and he's number 1 in the system. And it's, again, auto-generated number for the ID, which is the primary field in this. And let's take a look at the appointment table. And this just has, again, this is the appointment ID, an auto-generated number here, the date of the appointment time. And the way doctors' offices use this, a lot of times they actually have a table that has the appointment slots available for that particular day and things like that. So that's how those typically work. Patient ID is this just identifying the patient. I didn't do these as lookup tables, but just because of time savings and things like that. but this is linking to that patient number 1 on the patient table. And then physician ID, this is that specialty physician we'll get to in a second. And then the referral ID just shows that there's a referral in place. So let's look at the physician. Again, these are the physicians I have in here, just sample data. The first one's an orthopedic doctor, and then the second one's a cardiologist. And they just have a simple auto ID as well. And go to the referral table. This one has, again, auto generated number for the ID note of the field. And then this referral authorization is what the doctor will usually generate and say, you know, here's your authorization number. It's kind of like a check number or something like that if you want to relate it to something. And that referral is going to authorize you for a certain number of visits. Here this person is 4, and they're being referred for evaluation and treatment. And there's other ones, medication, you know, maybe for CT scan or something like that. You know, there's different specific purposes a lot of times that these referrals are done for. And they have issue dates and they have expiration dates. And a lot of times the expiration dates fall along the fiscal year for the insurance company who's actually paying the bills and everything. So, and then again, you have your patient ID, physician ID, and the primary care manager ID. And that's how that data is all put together. So let's take a quick look at the relationships. Again, this is like my ERD for the most part. You can see the connections that are made. You have 1 primary care manager per patient, 1 patient per appointment, 1 physician for an appointment. They can have many appointments under that physician, or you can have many appointments for this patient. You know, those are the ways these are set up. Referrals, you have 1 referral that can cover many appointments, the many visits that I showed you there, and then 1 person can have many referrals. So that's how those are all linking together. Okay, let's move on to my queries I have. I have a couple of them here, and first one is called the daily appointment check. And what that is it's a checks every day, you know, that would be run by, say, the front desk staff of the place where, you know, where they make the appointments or schedule them. They would look at this and see, well, hey, do we have any referrals expiring for these appointments we have coming up? And so with them, you know, I use the referral table, the primary care manager, patient, and appointment table. And what I did is I broke it down by this first criteria is anything after today's date. So I'm looking in the future. And if it has the number of visits on the referrals is less than 1, meaning they have no visits remaining on that authorization, then it's going to kick out in a report. Or again, looking in the future, date greater than today, and the appointment date of expiration, or the expiration date is before the appointment date, then it's also going to kick out, meaning that that authorization has expired. So let's take a look at that in the actual report. See here is how it would come out. You have shows you the primary care manager who's responsible, who, you know, you'd have to call to get that updated, their phone number, the patient's name, and then their appointment date they have an appointment for, and showing here that the appointment's expired the day before their appointment. And this one is expired a couple months ago. This is back last fiscal year, you know, way before their appointment. So even though they might have visits remaining, they're still going to show up on the list because the expiration dates of the referrals. So that's basically the daily check that's there. We have a weekly. Let's take a look at the design of that one using the primary care manager table, patient table, and referral table. And I have 2 really main criteria that I'm looking at, actually 3 criteria. Is again, if it's the number of authorizations is less than 1 or 0, it's going to show up on the list. If the number is less than 2 and the purpose for the visit or the purpose of the referral is for medication, and an example of this would be, you know, a patient that's on chemo or something like that. You know, if they're coming in weekly for chemo, you don't want them to get down to their last visit before you start checking on getting an authorization for the next few. A lot of times they'll do, you know, they'll put these in 100 or so at a time or something like that. And that way, you know, you don't hold that patient up from being seen and getting their chemo because you didn't have a referral in the system. That's the purpose of it. And then this last one I'm looking at is, again, the expiration date of the referral. And you see here the date plus 7. So what I'm doing is I'm looking out 7 days in advance. And if any of those are expiring in 7 days, they're going to show up on my report. So let's take a look at the actual report. Again, we have the primary care manager's name, their phone number, and then the patient's name. And you'll see here their referral expiration date. This one's a referral expiration date. And this one is shown on here because it has 0 visits. And it is also expired by date, but it would show up either way. So those are ways, and then you can take that and say, hey, I need to get these updated, or they might say, well, we don't need to have them seen or treated anymore, or maybe the patient passed away, and whatever. But then you would have to have another thing in here to capture that as a dead file, for the most part. You don't want to typically delete them out of the system because that can cause some problems with the system. But there's other options that are out there as well. But anyway, at least that keys you to know that that patient's there, and something needs to be done with them. So anyway, those are my reports that I have for this, and as well as my database. Everything is linked up and working pretty well here. Some of the areas, like I said, I would consider wanting to change if I were to do this a little more formally and everything is an example with the number of visits that are authorized. When an appointment is made, I would decrement the authorized number of visits, because each time it would take one of those away, and that would go down until it reached 0 or 1 or whatever. So right now we'd look at it, we'd have to probably do it manually, but it could be done with scripting and stuff that just didn't have time with working with this one. In other areas, again, like I showed you in the table linking and stuff, to look up tables for patients to make sure that the data integrity is good. I would use that a little more throughout. And places where, let's say you go to put in a primary care manager and they're not already in the system, once you got to that field in the patient table, then it can link you over and allow you to fill out the primary care manager and put that in there and populate that whole linking field and everything like that. But again, I didn't have the time to do it here. So let's go back over to the PowerPoint real quick. And a lot of these things I would like to implement in here with real-time checks, but it makes it kind of difficult with the amount of time like I said, I had to put towards this. And I did this particular one again as I wasn't part of a group. I did this as an individual, so I had a lot of work on myself here. Anyway, that was pretty much it with the database part of it. The reports, like I said, looking at the scripting and stuff like that, there's a lot of different ways you can look at it. The appointments scheduled, you want to make sure they're not expiring, or visits are worked out, things like that. Like I said, that's something I would like to see when you schedule that appointment. It would pop up right away and say that, and maybe the patient might have some information on it and say, well, hey, the doctor just said they were sending a new one over, or something like that. And that way it's just another check. But again, we didn't really get into the data entry fields and stuff like that. As far as building forms for data entry, we did it more for just filling these tables out. So anyway, my next slide here is just my references, which was my business case for the appointment referral linking system. And I used that in the executive summary. So hope you enjoyed, hope this answered questions, and hope you got a better understanding of what I was trying to accomplish here with this. And if you have any questions, feel free to shoot me an email. I'm in the Sky system and everything. So thanks, and enjoy.